Welcome to the Foresight Health Roundup podcast, Foresight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at Foresight Health. It is Thursday, May 1st. Happy May Day to everyone. A special shout out to my good friend Dave May, who I worked with for years. He always insisted that May Day was about him. Who am I to argue? On today's show, we're going to talk about who large vertically integrated healthcare corporations are for. We're going to figure that out with Dave Johnson, founder and CEO of Foresight Health, and Julie Murchinson, partner at Transformation Capital. Hi, Dave. Hi, Julie. How you two doing this morning? Dave?
Doing all right. I'm feeling pretty good myself. Clearly channeling my inner and modified Joe Cocker this morning.
Very good. Very good. I caught that. Julie, how are you?
I'm great. I've just had a gorgeous week in Boston this week. And last week was in Scottsdale, hanging out with a bunch of health systems. And I gotta say, I'm starting to feel some movement, like something is happening there for sure. And I got to sit next to Judy Faulkner at dinner. It was very interesting.
And I'm sure you were very polite.
I was very polite.
Good for you.
Did you get an invitation to stay overnight in one of their tree houses outside Madison?
I did not.
Next time.
That's on my bucket list. I got to figure out how to infiltrate and stay in a tree house.
We should honestly take a field trip.
That means we have to go to Wisconsin, you know.
I can handle it.
All right. All right. Before we talk about vertical integration, let's talk about May Day. Dave, does May 1st hold any significance for you other than it being the first day of the month?
Birthdays. It means birthdays. In the next 10 days, including 2 today, I've got a wife, a sister-in-law, a niece, a grandnephew, and a grandniece that have birthdays. Way, way, way too much Taurus in our family.
That credit card's going to get a workout. Julie, how about you? Any takes on being May 1st?
I mean, other than the fact that it's almost Cinco de Mayo, no, not really.
Well, for me, it means I could start planning things outside with the chance of frost being pretty slim. More importantly, in the Burda household, next week is National Nurses Week. And if I forget that, frost will be the operative word. Okay, let's talk about vertical integration in healthcare. And like our April 17th episode, I'm going to ask you to comment on someone else's commentary. In the April 9th issue of the Journal of the American Medical Association, 2 former Justice Department antitrust officials published a viewpoint entitled The Rise of Healthcare Platforms. The 2 authors are Jonathan Cantor and Martin Gaynor. I know Marty from my days covering antitrust as a healthcare legal reporter. By platforms, they mean large conglomerates that operate previously independent and competing healthcare segments under one corporate umbrella. So, one corporation runs health plans, retail pharmacies, pharmacy benefit managers, medical practices, home health providers, long-term care providers, data companies, hospitals, and more. The authors pointed out a number of negative effects of platformization, such as limiting competition, creating conflicts of interest, and gaming business regulations. They said it, quote, undermines the ability of healthcare markets to function adequately, making the U.S. healthcare system even more expensive, unresponsive, and inaccessible, close quote. Not surprisingly, they called for more aggressive antitrust enforcement to prevent platformization, lest we have a, quote, private profit-seeking single payer without oversight or competition to constrain it, close quote. Pretty scary. Dave, what's your reaction to this commentary? Is it overstating or understating the issue? And what would you do to make vertically integrated companies work better for the market and for consumers?
I'm schizophrenic on this article, really of 2 minds. So I'll talk about each side of the brain here and what separates them. First is the authors are absolutely right. These massive companies with the vertical integration even without vertical integration, have sufficient market power to exercise monopoly and monopsony pricing power. That's true in regional markets, increasingly true in national markets. In regional markets, any good-sized health system can have monopoly power. Any good-sized insurance company can have monopsony pricing power. So it's not just the big conglomerates. You see it everywhere in healthcare, devices, big pharma, market failure, massive industrial complex, vast intermediary layer. We talk about it all the time. Julie mentioned Epic. Then you see companies like Epic that really practice a form of information arbitrage where they try to control information that should be widely and publicly available, and they do it within a walled garden. So they're right. The question is, will better antitrust regulation help? I mean, it probably can't hurt. But if this were easy, we'd just break up these big companies like we broke up AT&T, and the world would be a better place. AT&T, Standard Oil, we have a long tradition of doing that in this country, and maybe we need to do some of that. And they draw a lot of comparisons between healthcare and the big tech companies, the Googles, the Apples, the Metas, and so on. But I don't think it's exactly the same, because those big tech companies are exercising traditional kind of market leverage in a way that profits them, but still delivers overall value to the economy. In healthcare, we actually have these massive companies operating in ways that enrich them, but deplete from the overall economy. Luigi Zangales, who's an economist at the University of Chicago I like a lot, wrote a book in 2012 called A Capitalism for the People. And he identified whistleblowers and class action lawsuits as strategies that help keep the big guys in line. And I keep thinking about these fiduciary lawsuits that employees are bringing against their employers for not acting in their best interest and purchasing health insurance. And I think more than any regulatory scheme that the authors could come up with, the success of those fiduciary lawsuits could fundamentally change market behaviors, improve supply dynamics. So anyway, that's the one half of my brain, probably the logical half. The emotional half said, this article should have been written in a journal called Caveman Chronicles. To think that incremental regulatory improvement can fix a broken system is just nuts. And the only thing that can get us out of this is platforming, but it's platforming of a kind that practices P4 medicine at scale: personalized, predictive, preventive, participatory. I mean, imagine in the not too distant future being able to engage with a platform company that allows us to speak to our own biology with full information on us, right? Genome, epigenome, all of our medical tests and so on. And if you have a question, ask AI. Also, we're very close to creating something called digital twins that will allow us to test out certain treatments, pharmacological, surgical, so on a digital twin to see and predict with some degree of accuracy, which will get better over time, what the impact will be. Will there be side effects? Will it be beneficial? And so on. So the only thing that's going to really change the supply-demand dynamics and get the right balance between prevention and treatment are platform companies that are operating with the proper incentives that are focused on delivering value ultimately. In Shakespeare's Romeo and Juliet, Juliet says at one point, what's in a name? A rose by any other name smells as sweet. A platform by any other name doing the right thing guarantees better health outcomes or generates better health outcomes at lower prices with great customer service. So, platforms are here. Some are bad, some are good. Let's embrace the good platforms.
Yeah, we need the right kind of platform. Thanks, Dave. Julie, any questions for Dave?
Okay. As a former CPA, I think a lot about the geeky things that could make a difference here. And we're at a time where literally some of the foundational businesses of healthcare are shifting. So I was thinking about the role that just simply public financial reporting plays in these like massive consolidated models. Do you think that a more detailed look at service line or business level reporting financially could help us all understand the value that some of these scaled entities bring and, maybe help us see how some of these businesses need to morph in patient interest?
I think what you're really asking is, could better financial reporting illustrate the damage these companies cause rather than the benefits they bring.
Well, yes.
I wish I could be more optimistic. I think financial reporting exists primarily to serve investors and debt and equity capital markets, and can always be better. I think it does a good job at that in terms of letting investors evaluate companies with a fair degree of transparency on financial performance and so on. When we start adding other reporting requirements on top of this framework, it creates potential market friction without necessarily delivering the desired benefits. So I keep coming back to, our market's broken in healthcare. So how do we get companies incentivized the right way so that the supply-demand dynamics really do begin to deliver for the American people? And I really don't think we can do that without fundamental payment reform. So that's where I am on that.
Yeah, thanks, Dave. I've never known a Chinese wall to work. Oh, we put up a Chinese wall. Right. Okay.
It certainly didn't work in China.
Right. Yeah. I don't think so. All right, Julie, it's your turn. Is this piece on target or off base, and why? And what would you do to prevent any negative effects on market innovation created by large vertically integrated healthcare corporations?
Well, I rolled my eyes so many times when I was reading this, and I had to remind myself that healthcare is a weird business, right? It doesn't function like other businesses. So I really took the contrarian view to say that it's largely off target. They've raised valid concerns about consolidation, as Dave talked about, but the aggressive antitrust perspective just overlooks the need for integration to simplify our crazy, overly complex system. And frankly, for a few decades now, we've been trying to fix the system through more federated models, right? Where everyone can remain independent but coordinate. And that's not working either. So, integration should drive the coordination we need for care improvement. And big tech monopolies focus on data control. But in this case, I think to some of Dave's points, integrated healthcare entities should reduce duplication and frankly should be in a position to help patients and people through better communication. I personally think that scale is critical for innovation. If you look at just the data infrastructure needs, large healthcare platforms can invest in those things where smaller entities can't. And I don't know, this whole antitrust angle just feels like they're focused on the wrong thing. Antitrust should focus on where's the harm to patients and payers, and not just the presence of large integrated firms that are frankly behaving as one would expect, in capitalism. I thought it was funny the abuses like gaming MLRs and upcoding. Valid, right? But I frankly think they can be addressed without breakups. Structural separation doesn't help MLR gaming necessarily, or doesn't help upcoding. It's still going to happen. I think that's stupid. I think we're making progress in some of these models, and now I don't think now is the time to actually pull this card if we're going to pull it. I think there are other things that we can do. So what would I do? I would, of course, want to preserve innovation and protect market entrants and keep that competition up and let scale sort of do its thing. Dave, I think you'll like some of my thoughts, but
probably will. I know I will.
Yeah, for sure. I think transparency is everything here. Transparency in data access and interoperability, as well as platform neutrality. So let's enable startups and these niche players to build the tools that they need to, even within the big platforms, without the bias of, the big platforms. And let's talk about transparency in price and performance, and enable the choice of higher value providers, even if those providers are outside the large platforms. Transparency goes a long way here. I would try to deal with anti-competitive self-dealing behavior. Let's make sure there's fair competition for the independents and innovative providers. And I guess I'd think a lot about the best of breed mentality here. Let's encourage diversity of ideas and allow alternatives to some of the vertical integration to flourish, right? That's how markets evolve. And it probably goes without saying, but you need to constantly push against the conflict of interest and strengthen that oversight, because platform behavior is platform behavior, and we have to keep it in check. And I frankly think keeping it in check also engenders trust, and we need more trust in, some of the emerging models. So for me, it's really about guardrails and not roadblocks.
Yep. People and behaviors, right? I think you said the word behavior, half a
A
dozen
lot.
times in there. Yeah. Yeah. No, it's important. Thanks, Julie. Dave, any questions for Julie?
Well, Julie, I wanted to ask you how tariffs could help the situation, but then I caught myself. And
Yeah.
what
Good.
I really,
How much time do you have?
Yeah.
I wanted to get your favorite example of a healthcare platform, the right kind of platform that is capable of scaling nationally. I bet you've got a few favorites tucked away in your pocket.
What would I scale? Yeah, there probably are a lot of things I'd scale, actually, maybe. But if I'm pressed for one, I think a lot about cost and quality, and frankly, who has or has the potential to be a really strong clinical brand that people believe in. And I guess it depends on what kind of model you're thinking about scaling. The one I have in mind as I'm saying this is different than perhaps other examples where they would spike. But I think I've mentioned here Baylor Scott and White is kind of my new favorite example. But the retooling they've done around what does quality care look like? How should care be delivered in certain service lines in a way that's highly digitally enabled? They're figuring out how to deliver care at much lower cost. And there's something there that they're doing. And I don't know if it's because they're in the market they're in and how they're doing it, but their HMO star ratings are high. Their PPO star ratings, I think, are a little bit lower, which might demonstrate that it's harder to build a more integrated platform in an open model way. But I frankly just think that's probably the schizophrenia of our current reimbursement system. But they're doing something special there. And I don't know, if they could try it outside their market, I think it'd be very interesting.
Yeah. It's people doing the right thing, right? So right now, I think it's all about controlling each step along the production line. No matter where a patient stops along that line, the company gets a cut by limiting patient choice. And what are they singing 16 tons, Dave? I owe my soul to the company store, right? You know that one.
I do.
And this is why we need a customer revolution in healthcare. So no better time to start than May Day, right? And that brings us full circle to what else happened in healthcare this week that we should know about. Julie, what else happened in healthcare worth mentioning?
Well, I'm sure that folks have seen over the last week or two, United's numbers were not what the market expected. So we've seen this week a turnover. Heather Gianfranco has stepped aside, and our friend Patrick Conway is now the new Optum CEO. Big news.
All right. Wish him well. Thank you, Julie. Dave, what else happened this week that caught your eye?
I write for the HFM magazine, and they've got a new feature called Fast Finance. And so I'd encourage everybody to check that out. But they are reporting that the Republicans in the Senate and inside the Trump White House are moving fast on changing the 340B program in ways that will hurt hospitals. They're also beginning to look at modifying, maybe even eliminating the Medicaid match programs. If these changes go through, they will have a major impact. So if you're looking for a disruptive force, look no further than 340B and Medicaid match programs.
Right. They are big pieces of the current business model. So,
Dave, I just want to say I have heard that they're going to go after site neutrality before anything. So the rumors are just rampant.
Yeah. Well, that's another big one, right?
Yeah.
Well, like we don't have enough to talk about on this show. Right? Thanks, Dave, and thanks, Julie. That is all the time we have for today. If you'd like to learn more about the topics we discussed on today's show, please visit our website at foresightshealth.com. You also can subscribe to the Roundup on Spotify, Apple Podcasts, YouTube, or wherever you listen to your favorite podcasts. Don't miss another segment of the best 20 minutes in healthcare. Thanks for listening. I'm Dave Burda for Foresight Health.